Some of the clinical duties that an Aboriginal health practitioner would do is in the general clinic they'd do basic observations, run programs, health promotion. They may manage care plans with a doctor. There's care coordinators now as well. I'm talking in this thing alright. They do advanced clinical. Aboriginal health practitioners administer medications, respond to medical emergencies. If they've done the vaccine provider course, they give immunisations, do specimen collection. That's all types of specimen collection, including blood. Suturing. They do IV cannulation as well and IV therapy. Maternal and child health. Many have had to deliver babies in an emergency. They respond to car accidents, things like that, because in the community there's no hospital. And often it's just a nurse and a health worker that are responding to situations. They also have they advocate for traditional healing as well. And you may be asked that in some situations when people are sick, they may choose not to go for Western medicine. They may want to opt for traditional healing, which is their right. And Aboriginal health practitioners, we have to practice under our standard treatment manual and standard procedure manual, which is the CARPA and the CRANA, and the immunisation handbook, and those various things that everyone has to go by to protect ourselves. So, there's all those things about gender sensitivities. Aboriginal health workers, unlike a nurse, we are more wary of being sensitive to our opposite sex. So often, and that can be sometimes why Aboriginal health workers who go and do nursing pull out, because they've been a health worker and it's just not culturally appropriate to be working, to be treating someone of the opposite sex. And so you may come across people that don't want to in emergency situations, though we have to, but so they're sensitive to that the opposite sex. They perform consultations in the clinic, listening to people's stories, so they take their story, they do a full consultation, and including treatment and management of the client's health problems. They do follow-up, including immunisations and any other activities. They provide advice on healthy living matters, healthy lifestyle. Up the top there, they prescribe and dispense pharmaceutical drugs as appropriate, and follow all the protocol there that anyone else has to when it comes to dispensing. They assist in maintaining the pharmacy in a safe and orderly state. They seek advice when necessary. They record in their clinic notes details of the consultation, including the history, any examinations and follow-up, and referrals. I mentioned about responding to medical emergencies. So it's got there about delivering healthcare to children, women or men, youth. They deliver substance abuse care, nutritional and mental health. One of the things with Aboriginal health practitioners is they've become very clinic focused and clinic based, and you'll come across some health centres where it's because of the just not enough people on the ground, on the floor in the clinic, to meet the needs of all the acute problems coming through the door. But wherever possible, Aboriginal health workers should be encouraged to get out and do some health promotion, do some school screening, things like that. I mean, it looks like they do way too much, and they do. Aboriginal health workers end up wearing lots and lots of hats, and as they grow, the more health workers we can get, the more health workers can specialise in certain programs. So I guess I've given a bit of an idea. The main thing I wanted to give an idea is the scope of their practice, because what we find is that Aboriginal health practitioners are often misunderstood, and it's not clear what their role is, and they can end up being asked to just do interpreting for the doctor or the visiting specialist, when there's so much more than that. They can end up just answering the phones or being the driver, and that's all the things that they're not. There's usually somebody that can do that, and Aboriginal health workers, a lot of them have been there for many years, and their skills and knowledge and expertise can be taken for granted. What we find, what in the Aboriginal community-controlled health services, as Erin mentioned, we've got the leadership program. We're also looking into management training, because we would like to see our Aboriginal health workers being the clinic managers, because they are the foundation of the clinic. They're there when everyone else comes and goes. You know, a lot of people are on 6-week or 3-month contracts, you know, so they're not there, and it's the Aboriginal health workers that are there, and the Aboriginal staff in the clinic